This PowerPoint is going to present the pharmacology for the cellular reg units. I first want to go over chemotherapy precautions again. They do vary by facility. You must wear 2 pairs of gloves if you're administering chemotherapy drugs, and remember, only certified nurses are going to do this, not as a generalist new nurse. You would not do that. Must double flush the commode. Teach the client to do this at home. And we have to double bag or use a special hamper for any clothing or linens that the patient is using in the facility. So supportive medications for chemotherapy, Zofran was actually created specifically for chemotherapy-induced nausea and vomiting. It is a serotonin blocker and it works as an antiemetic. It is available oral. Not only pills, but it also comes in ODT, which is an oral disintegrating tablet, and we give it IV most of the time because if people are nauseated, they're not likely to swallow a pill. So the usual dose for chemo is 8 milligrams 3 times a day. Zofran is typically given 4 milligrams at a time unless it is for chemo. IV dose 0.15 milligrams per kilogram. We can give that every 4 hours. You can dilute this medication if you want to. You may want to do that and dilute that with saline because it is a small dose. 4 milligrams is going to be about 1 milliliter. It's very difficult to give 1 milliliter over 2 to 5 minutes. It begins to work very quickly. The duration is 6 to 12 hours, although most of the time it is ordered at least Q4 or Q6. Phenergan is a very old drug. It is a phenothiazine. This drug was given in the past with narcotics because it would potentiate the effect of the narcotic. It is an antidopaminergic. It is used as an antiemetic. As again I said, very powerful drug, not usually given to regular patients. We used to give it all the time, but it is very dangerous when it is given IV. It can cause immediate respiratory collapse. So we can give this IM, IV, or per suppository rectum. This medication must be diluted with at least 10 milliliters normal saline. It is very caustic to the vein and it burns. Most of the time you're going to see this as an IV piggyback if it even gets to be ordered, so it doesn't destroy the veins because chemotherapy patients don't have very good veins to begin with. Oral 125 milligrams a day on day 1 and then 80 milligrams a day. Again, that's a chemotherapy dose. There's some other doses here. So Phenergan, powerful drug, caustic to the vein, must be diluted if given IV, preferably given IV piggyback. Reglan is a drug that has a lot of different uses. For this, of course, it's an antiemetic. It is a prokinetic medication, so that means it increases gastric peristalsis. So a lot of times you'll see Reglan given and not necessarily for nausea and vomiting. It helps things move along. It increases peristalsis for patients who have an ileus or something like that. It is a dopamine antagonist, again used as an antiemetic. As I said here, it is available oral, IM, or IV. Most of the time you're going to see it given IV. Orally 10 to 15 milligrams 4 times a day, 30 minutes before a meal. It is weight dosed for IV doses 30 minutes before chemotherapy. Or we can give it IM. Of course, we wouldn't do this near the end of surgery. Marinol is just what it says. It's a tetrahydrocannabinoid, which means that is THC. So this is, medical use marijuana. It is used as an antiemetic. It also will increase appetite for people. A generic name is dronabinol. It is used for chemotherapy-induced nausea and vomiting. It is given orally. These are the doses, and it can be given up to 6 times a day for 3 days. So neutropenia, which is a low white count, is a real problem with people who receive chemotherapy because of the bone marrow suppression. This is its pharm class. It's a G-CSF. It is a hematopoietic, so that means it creates blood cells. It helps prevent bone marrow suppression. We can give this IV. Patients can give it subcutaneously at home. IV or sub-Q is 5 to 10 mics per kilogram per day. It cannot be given if the patient has already developed an infection, and we need to monitor the absolute neutrophil count, and it will be discontinued. Of course, that will be by the healthcare provider if their ANC is greater than 10,000. Neulasta is a derivative of this drug. It is a longer acting form, and they don't need as many injections when they take Neulasta. Treatment of anemia, again from bone marrow suppression. They have low RBCs. Erythropoietin is actually a hormone that comes from the kidney. So we see a lot of kidney patients who have to receive Epigen to treat their anemia. This drug stimulates erythropoiesis. Used for chemotherapy-induced anemia. We can give this IV or we can give this subcutaneously. This is the DOTE. It is weight-based. Mycostatin or nystatin is an antifungal medication. Is used to treat stomatitis. This would be for oral candidiasis, which is a yeast infection of the mouth. Happens from chemotherapy or antibiotics that kill the good bacteria as well as the bad bacteria. This is given orally 4 times a day, and this is a swish and swallow medication. They take it in their mouth and they have to swish it for 5 to 7 seconds or something, and then they go ahead and swallow it. So it will also treat esophageal candidiasis. Megase is another chemotherapy drug. It stimulates the appetite, used for chemotherapy-induced anorexia. It is only given oral. It is in pill form, and this is the usual dose.